Many men past 60 are told the same thing at every checkup. You need your prostate tests. It's mandatory. It sounds responsible, even life-saving. But what if that routine order has been doing more harm than good for thousands of healthy men? Today, I'm breaking a quiet truth most clinics never explain. Some of the most common prostate tests pushed after 60, especially after 70, can start a chain of unnecessary biopsies, surgeries, and lifelong side effects that were never needed in the first place. I'm Dr. Catherine Rotker, a board-certified urologist. For over 20 years, I've treated men across every stage of life, and I've watched how one simple test can turn a healthy man into a long-term patient. These stories stay with me. A man comes in strong and active, agrees to a routine screening, and months later, he's recovering from a surgery that did nothing to extend his life. That's not prevention. That's a system gone off course. Why does it happen? Habit, fear, and profit. Our medical system rewards doing more, not necessarily doing better. And for seniors, that pressure can drown out the evidence that says sometimes less is safer. You deserve to know the truth behind these so-called mandatory tests, because making an informed choice could save your independence, your confidence, and your quality of life. By the end of this video, you'll understand which 3 common prostate tests deserve your skepticism, how to separate real warning signs from medical noise, and how to protect your health without surrendering it to unnecessary procedures. This is for every man over 60 who feels well but wonders if he still needs all these tests, and for every family member who wants to keep him that way. Major medical bodies like the American Urological Association and the U.S. Preventive Services Task Force have quietly but decisively shifted their guidelines. They now advise against routine PSA screening for many older men. But on the front lines, in the doctor's office, these updated guidelines haven't caught up with old habits. Let me tell you about a patient I will call Henry. He walked into my clinic last year, a vibrant 72-year-old who spent his days gardening and traveling with his wife. He felt perfectly healthy and had no urinary problems. But he was frightened. During his annual checkup, his doctor performed a routine prostate exam and a PSA blood test. The test result came back just slightly high. Now his doctor was insisting on a prostate biopsy. Henry was suddenly facing the real possibility of a cancer diagnosis and treatments that could lead to incontinence or impotence. His world had turned upside down from a single test he was told was mandatory. I see this same story play out again and again. A healthy man, feeling well, is pushed into a pipeline of testing that hasn't kept up with the science. Decades ago, we believed testing often meant living longer, but the evidence has changed. Now we know that for men past 70 who have no symptoms, some of these mandatory prostate tests don't just fail to extend life, they can actually shorten it by triggering complications that never needed to happen. I've seen men spend months recovering from infections or struggling with side effects from treatments that offered no real benefit. And all of it began with one simple test that was never truly needed. What I shared with Henry that day changed everything for him. It gave him the clarity to make a decision he felt confident about. I will give you that same knowledge. I am going to provide you with clear, evidence-based guidelines that show when a test is truly necessary for you and when it may do more harm than good. This understanding offers real protection for your health and your peace of mind. What you learn here will help you safeguard the active, fulfilling life you deserve. The approach to prostate health needs to shift for men in their later years, and it all comes down to a simple but powerful idea we call time to benefit. Think of the most common type of prostate cancer as a very slow-moving condition. It often takes 10, 15, or even 20 years to become a serious threat to a man's life. Now, consider the risks that come from investigating and treating it. Procedures like biopsies can cause infections. Treatments can lead to lifelong incontinence or erectile dysfunction. These risks are not distant possibilities. They are often immediate and permanent. So, for a healthy man in his 70s, the math changes profoundly. You could be trading your current quality of life, the things you love to do without any problems, for the small chance of preventing a problem that might never have affected you. You are considering a certain loss today for a highly uncertain gain far in the future. This is not refusing care. It is making a thoughtful choice to protect the healthy life you are already enjoying. Before we look at the specific tests, I want to give you a practical tool for your next doctor's visit. I will provide you with 4 straightforward questions. These questions will help you and your doctor have a productive conversation about what is truly best for you. They will transform you from someone who is simply told what to do into an active, informed partner in your own healthcare decisions. This is how you take control. The first test I want to discuss is the digital rectal exam, or DRE, when it is used as a routine check in men with no symptoms. This is the physical exam where a doctor feels the prostate. For a long time, this was a standard part of a man's physical, but medical thinking has evolved. Major health advisory groups no longer recommend the DRE by itself as a screening tool for prostate cancer in men without any warning signs. Many doctors still perform this exam out of habit. It feels thorough, it takes only seconds, and it gives a false sense of reassurance that nothing has been missed. However, a finding that something feels slightly irregular, which can be very subjective, often sets off a chain of follow-up tests, a PSA blood test, an MRI, then a biopsy. Each step adds more anxiety and risk. The habit of checking by default, rather than for a clear reason, keeps an old routine alive long after the data has moved on. In some clinics, that habit is reinforced by a system that rewards doing more tests, not necessarily better care. The real risk of a routine DRE is not the brief discomfort. The true danger lies in its inaccuracy. It's a very subjective test, meaning 2 doctors can feel the same prostate and describe it differently. What feels slightly uneven or nodular may be completely harmless. Yet, once that word appears in your chart, you're suddenly facing biopsies, possible infections, and weeks of worry. For many healthy men in their 70s, that stress and the potential complications far outweigh any benefit from finding something small and slow-growing. The research on this is very clear. Studies show that adding a digital rectal exam to PSA blood test does very little to help find dangerous cancers early. What it does do is raise the number of false positives, cases where the test looks suspicious but turns out to be nothing serious. That leads to more biopsies and more treatments that don't improve survival. By this stage of life, time and biology matter. If a tumor is large enough to be felt during a DRE in a symptom-free man of 75, it has likely been there for years and is growing slowly. Many men live long lives with harmless prostate cancers they never knew about. The danger comes not from the tumor itself, but from labeling it and reacting with aggressive treatment that harms more than it helps. The benefit of catching such slow changes at this age is small, while the risks are significant. Now, it is important to be clear about when this exam is useful. If you are experiencing specific symptoms like pain, blood in your urine, or a sudden major change in your urinary habits, then a digital rectal exam becomes a valuable diagnostic tool. In that situation, we are no longer screening. We are investigating a concrete complaint. Likewise, if you have a strong family history of prostate cancer, your doctor may decide a focused exam is justified. The key is context. When you feel well, routine DREs after 70 add little value. When symptoms arise, they can be useful. The smartest care at this stage is selective care, testing when there's a reason, not just because it's written on a checklist. The second test is the PSA blood test. This simple blood draw has become one of the most controversial topics in men's health. The test measures prostate-specific antigen, a protein made by the prostate gland. Higher levels can sometimes mean cancer, but they can also rise from harmless causes like an enlarged prostate or even mild inflammation. Over time, studies have shown that this test often finds cancers so small and slow-growing that they would never cause trouble. Yet once they're found, men are labeled as cancer patients, leading to treatments that bring side effects without extending life. That's what doctors now call overdiagnosis, finding a problem that never needed fixing. This test remains so common because it is deceptively simple. It is just one more tube of blood during a routine checkup. However, a slightly high PSA level is the most powerful driver of referrals to urologists, and often a biopsy. It's also financially rewarding for the healthcare system because one elevated result sets off a chain of profitable follow-ups, imaging, biopsies, surgeries, and radiation treatments. Doctors mean well, but the reflex to do something can do more harm than good. It may surprise you to learn how common these harmless cancers are. By age 80, more than half of all men have some prostate cancer cells. The vast majority of these are slow and pose no threat. For a healthy man in his 70s, the statistical chance of dying from a new aggressive prostate cancer is significantly lower than the chance of dying from heart disease or other common conditions. This context is vital. The U.S. Preventive Services Task Force, a leading independent panel of experts, gives routine PSA screening for men over 70 a D grade. This is the lowest possible rating. It means they have high certainty that the harms of this screening outweigh any benefits. This conclusion comes from decades of research involving hundreds of thousands of men. The harms are serious and quantifiable. An elevated PSA typically leads to a biopsy. For men over 70, the risk of a severe infection from a prostate biopsy that requires hospitalization is between 3 and 5%. If the biopsy finds a cancer, even a low-risk one, the psychological pressure to treat it is enormous. The treatments themselves carry profound risks. Surgery for prostate cancer in a man over 70 carries a more than 50% risk of long-term erectile dysfunction and a 15 to 20% risk of significant urinary incontinence. You could be trading a condition that would not have harmed you for life-altering side effects. This is why every major medical authority now agrees. The U.S. Preventive Services Task Force, the American Urological Association, the American Cancer Society, and the Centers for Disease Control all state that routine PSA screening is not recommended for men with a life expectancy under 10 to 15 years. Unless there's a strong family history or very unusual circumstances, this test offers no clear benefit for men in this age group. If your doctor still orders it by default, it's worth asking why. Medicine has evolved, and the best care today isn't about testing everything. It's about testing what truly matters for your health and your peace of mind. The third and most invasive test to question is the automatic prostate biopsy, sometimes preceded by advanced scans like an MRI. When a man has no symptoms, the offer for this procedure is often framed as being thorough or getting peace of mind. For a healthy senior, this pursuit of certainty can actually create a problem where none existed. It becomes a search for something to fix, rather than a response to a genuine health issue. This aggressive approach persists for a few key reasons. A biopsy is a significant medical procedure that generates revenue. The same is true for an MRI scan. In our healthcare system, performing more procedures is often financially incentivized. There is also a powerful fear of missing a diagnosis that drives many doctors to recommend just-in-case testing, even when the statistical risk of harm from the procedure is greater than the risk from a silent disease. The immediate physical risks of a biopsy are real. The procedure involves inserting needles into the prostate to collect tissue samples. For younger men, recovery is usually quick, but in older men, the risks are higher. We've already discussed the infection risk, which are common, and some turn into serious blood infections that require hospitalization. Significant bleeding, pain, and difficulty urinating are also frequent. There is a deeper, more personal risk. A biopsy can easily find a small, low-risk cancer that would never have caused you any trouble. This gives you a cancer diagnosis in name, but not in threat. The psychological burden of that is heavy, and it often leads to pressure for treatments you do no need. Major studies that followed men for 10 to 15 years show that for older men with low-risk prostate cancer, choosing immediate surgery or radiation does not help them live longer than simply monitoring the condition. However, the men who had immediate treatment suffered dramatically higher rates of incontinence and loss of sexual function. The treatment did not change their lifespan, but it profoundly damaged their quality of life. This does not mean biopsies are never the right choice. They are a crucial tool when clear warning signs appear. If a man has a rapidly climbing PSA, a very high PSA level, a definite lump felt on exam, or new symptoms like bone pain, significant urinary changes, or a sudden weight loss, a biopsy becomes an essential diagnostic step. The difference is between investigating a real suspicion and performing a routine check on a body that feels perfectly well. I remember a patient, Mr. Thompson. He was 75 and loved his weekly golf game. He came to me after another doctor ordered a PSA test simply because of his age. The result was slightly high, and a biopsy was automatically scheduled. Mr. Thompson felt healthy and was worried. We sat down and talked it through. We looked at the latest medical guidelines for a man his age and his excellent overall health. We discussed the very real risks of the biopsy versus the very small chance of finding a dangerous cancer. He decided to refuse the biopsy. We chose a path of active monitoring instead, simply keeping an eye on his health. That was 5 years ago. He is now 80, still golfing regularly, and his PSA level has not changed. He has never once regretted his decision to avoid that procedure. This approach is supported by a powerful consensus of evidence. It is not just my clinical opinion. Large and respected studies like the PLCO and ERSPC trials demonstrated that screening offers little benefit for older men. The Choosing Wisely campaign, supported by dozens of medical specialist groups, explicitly advises against PSA screening in men over 70. We also see that countries, such as the United Kingdom, with less aggressive screening practices, have similar prostate cancer survival rates, but far fewer men suffering from treatment complications like incontinence. The proof is there. This brings us to your most important tool. I want to give you 4 simple questions you can ask your doctor at your next appointment. These questions will help you both focus on what is truly best for your health. First, ask this. Based on my age and my current health, what is the actual probability this test will find a problem that could shorten my life or seriously harm my quality of life? This question requires your doctor to provide specific context for you. Second, please ask for numbers. Can you tell me the specific risks of this test? What are the chances of a complication, and what could happen in the procedures that might follow? Understanding whether a complication risk is 1% or 5% makes a big difference. The third question is perhaps the most crucial. If this test comes back positive, what would we do next? Would the result change my care in a way that genuinely helps me live longer or better? If the answer is that you would not pursue treatment, then the test may not be necessary. Finally, ask this. What is the official recommendation from groups like the U.S. Preventive Services Task Force or the American Urological Association for this exact test for a man my age? This ensures your care aligns with the latest evidence-based guidelines. These questions transform you from a passive patient into an active partner. They guide you and your doctor toward a decision that protects your health and the life you enjoy. When I meet healthy men in their 70s, I often tell them that the key to staying strong isn't chasing hidden diseases. It's building the habits that keep the body resilient. Tests may feel like action, but real longevity comes from movement, food, and mindset. The goal is not just to live longer, but to stay independent and vibrant in those years. Walking every day, keeping your muscles active, and lifting light weights can protect your heart and maintain your balance better than any screening test ever could. Exercise keeps your metabolism sharp and your circulation strong, which in turn supports your prostate, brain, and energy levels. Your diet matters just as much. A Mediterranean-style approach with colorful fruits, vegetables, whole grains, olive oil, and lean proteins nourishes your heart and lowers inflammation. It's not about strict dieting, but about steady, nourishing meals that your body can rely on. I also remind my patients that mental and social health are part of physical health. Staying socially connected and keeping your mind active through reading, hobbies, or conversation helps preserve your mood, focus, and confidence. Managing known conditions like high blood pressure, cholesterol, and diabetes has far greater impact on your longevity than extra prostate tests. These are the areas where modern medicine truly saves lives. Combine that with a simple philosophy of care. Seek medical help when symptoms appear, but don't hunt for trouble when you feel well. Respond promptly to what matters and skip the rest. Your health span grows from these foundations, not from endless screenings. In geriatric medicine, doing more doesn't always mean living more. The best doctors now practice what's called selective medicine, focused care that values thought over reflex. Testing less, when appropriate, protects you from the cascade of side effects that come from over-testing. That's why less is more isn't neglect, it's wisdom. For men specifically interested in supporting their prostate and urinary function, I often mention two well-researched natural compounds. Saw palmetto is a plant extract, and beta-sitosterol is a natural plant substance. Together, they work to support normal urine flow and can help reduce that frequent need to get up at night. By addressing these common comfort issues directly, you can maintain a better quality of life and avoid the concern that sometimes triggers a push for unnecessary tests. For those looking to support their overall health more broadly, I suggest focusing on a few key supplements that benefit your entire system. A high-quality omega-3 fish oil is wonderful for your heart and brain health. Vitamin D3 is crucial for your immune system and strong bones. Magnesium is a mineral that supports healthy nerves and can greatly improve sleep quality. This simple combination works on the core systems that keep you feeling strong and vibrant. Supporting your body in this comprehensive way helps you maintain the robust health that makes aggressive screening unnecessary. I want to be very clear about an important distinction. Refusing unnecessary tests isn't the same as refusing care. The goal is balance, protecting yourself without letting fear or habit lead to procedures that add no value. I always tell my patients, if you notice new or persistent symptoms, don't wait. Pain in the pelvis or lower back, blood in the urine, or major changes in urination should always be checked. That's when testing becomes meaningful because it's directed at a real concern, not curiosity. Before adding supplements or changing routines, check in with your doctor. Even natural supports can interact with medications or health conditions. The right approach is collaborative. You bring awareness, your doctor brings perspective, and together you choose what's safest and most effective. Informed refusal means staying alert, not dismissing symptoms. It's about asking the right questions, not avoiding the conversation. Safety comes from partnership and good judgment, not from blind compliance or blanket rejection. Real power in medicine after 70 comes from discernment. Knowing when to say yes and when to say no turns healthcare into self-care. You deserve to understand what each test means, what it might lead to, and whether it truly helps you live better. That is what informed consent was always meant to be, a two-way discussion, not a prescription handed down. True longevity is not about how many tests you take, but about how fully and freely you live. Many men have faced pressure to take these so-called mandatory prostate tests, and sharing those stories can help others find clarity. If you or someone you love has been through that decision, leave your experience below. Your voice can guide another man towards safer, wiser choices. And if this information has been helpful to you, please like this video and subscribe to the channel. Consider sharing it. Together, we can help more seniors live longer, stronger, and with greater peace of mind.